Hey everyone, this is Dr. Qazi, and in this video we're going to learn about what is meant by the absorption of the drug, what is the G.I.T mechanism of drug absorption, which mainly consists of the passive diffusion, facilitated diffusion, active transport and endocytosis, and finally what are the factors which affect the drug absorption into your body. The absorption of the drug is defined as the transfer from the site of administration directly into your bloodstream. Have a look at this diagram. We know that we can give the drug through various routes of administration, either through the intravenous route, you inject the drug into your cubital fossa, or through the intramuscular route into your deltoid muscle. You apply some kind of ointment or the transdermal patch on your skin. You can take the drug to the rectal route, or you can take the drug to the nasal inhalation. Now, all of these various routes of administration will eventually reach to your right atrium of the heart. Why? Because the drug is delivered into your venous circulation. The venous drainage will lead to your right atrium. After oxygenation from the lungs, the blood comes to your left atrium along with the drug. When the left ventricle contracts, the drug is delivered through the aorta into each and every organ of your body along with the drug dissolved. This is what absorption of the drug is. Now, there are three major factors which affect the drug absorption. The rate and extent of the drug absorption depends upon the environment where the drug is absorbed, the chemical characteristics of the drug, and finally the routes of administration. Now, the gastrointestinal mechanism of drug absorption consists of the passive diffusion, active transport, facilitated diffusion and endocytosis. The passive diffusion, in very simple words, it is the transfer of the drug from high concentration towards the low concentration. Now, there are two major types of drug which involve the passive diffusion: the water-soluble drugs and the lipid-soluble drug. The water-soluble drug will pass through the aqueous pore or the aqueous channel from high concentration towards the low concentration, from the extracellular space towards the cytosol. The lipid-soluble drug, on the other hand, they don't need the aqueous pores or the aqueous channel. They readily cross the lipid membrane because they are lipid-soluble. No problem crossing the plasma membrane. Now, because there is no carrier protein involved, so it is not saturable. The passive diffusion, on the other hand, is involving the transmembrane carrier protein. This is a drug transporter which is transporting drug from the high concentration towards the low concentration. The drug transporter is binding with the drug. It is undergoing a chemical change or the conformational change, releasing the drug into your cytosol. Because of this transporter molecule, it is saturable. What I mean by saturable is that when all of these carrier proteins are binded with the drug, no carrier protein is left, so it is saturable. Now, if you look at the active transport, it is the transfer of the drug from low concentration towards the high concentration. So when the drug is transported from low to high concentration, it will involve adenosine triphosphate ATP, which will be converted into the adenosine diphosphate. Now, again, the drug transporter is involved, so again it is saturable, because when all of these drugs are binded with this drug transporter molecule, no drug transporter is left, so it is saturable. It involves the energy in the form of adenosine triphosphate. It is used for those drugs which resemble the naturally occurring metabolites. Now, what will you do for those drugs which are of exceptionally large size, very large size? They undergo the process of endocytosis. There is the engulfment of the large drug molecule, and after pinching of the drug molecule, the plasma membrane along with the drug is transported towards the inside of the cell. Now, what are the factors which affect the drug absorption? The main important factor is the acidity at the absorption site, the pH at the absorption site. Have a look at this diagram. There is one basic rule of drug absorption: either it is acidic or the basic drug. The drug should always be uncharged and non-polar. Neutral drug will pass through this lipid membrane. Have a look. There are two types of drug: the acidic drug and the basic drug. The acidic drug will be transported in the form of protonated form or the neutral form. When this acidic drug releases the hydrogen ion, it is charged in the form of anion. Now this anion is repelled by the lipid bilayer membrane. It cannot cross it. So the acidic drug will always pass in the form of HA form to the lipid membrane. If you look at the basic drug, it will be passed again in the form of uncharged form. When it is protonated, it has positive charge on it, so it cannot cross the lipid membrane. It will be repelled by the lipid membrane. It will always be transported in the form of neutral, uncharged form. Now, how the blood flow and the surface area affect the drug absorption? We know that the arterial supply of your intestine is very much greater in comparison to the stomach. So the blood flow to the intestine will be great and the absorption will be great in comparison to the stomach. The surface area of your intestine is large as comparison to the stomach. Why? Because of these microvilli, the finger-like projection, which greatly increase the surface area. So the intestine absorption of the drug will be great as comparison to the stomach. Now, how the contact time affect your drug absorption? When you take the drug along with your meal, the stomach cannot absorb the drug properly because the food with the meal, with the drug, it's dilute your drug. It cannot be absorbed properly. In case of diarrhea, there is a rapid fluid flowing through your gastrointestinal tract, so less contact time with your intestine, so the absorption of the drug will be slow. The expression of P-glycoprotein greatly affects the absorption of the drug. How? The P-glycoprotein is a special 6-membrane protein. It's a transmembrane protein present in some organ. It transports the drug from the cytosol to the extracellular fluid outside of the cell by using adenosine triphosphate energy. So the absorption of the drug will be slowed when we have P-glycoprotein expression. This is all about the absorption of the drug, and I will see you in the next video.